It's Wellness Nerd Out time! What's going on, you guys? Happy Wellness Nerd Out time. And today we are going to be nerding out about the clinical manifestations of diabetes, type 1 and type 2 alike. All right, and we've been talking about diabetes for a few days here. And to kind of pick up where we left off yesterday, we were talking about how in type 2 diabetes, when we have all this glucose in the blood, right, and we don't have insulin promoting the proper absorption of glucose via the glucose transporters, right, because insulin can't trigger the intracellular cascade in our peripheral tissue cells to absorb glucose, right? And so it's in the blood, and where does it go? It gets absorbed, a lot of it does, into our beta cells, and it promotes the production of insulin by the beta cells, and they eventually get tired and produce less of it. And that's one way. You know, we talked about a few others, right? Like the accumulation of amylin protein that comes with the release of insulin from beta cells. That can damage the beta cells and make them produce even less, right? And the reduced insulin sensitivity of the insulin receptors, right? That will not allow us to trigger that intracellular cascade to open glucose transporters in the peripheral tissues in the first place, right? And so I kind of want to go from this concept of our beta cells becoming fatigued over time, right? The machine eventually fails, right? And they don't produce as much insulin. So analogous to this, when we talk about clinical manifestations, is the principle that when we have all this blood glucose, right, and the renal tubules in the glomerulus, right, our kidney tubules, responsible for filtering and reabsorbing glucose back into circulation, right? Well, they eventually try to reabsorb the glucose and reabsorb it and reabsorb it and reabsorb it, and they get tired as well. And they get tired, right? They can't do this forever, and eventually they fail to reabsorb that glucose, right? At least the vast majority. And so what happens is when these renal tubules in the glomerulus of the kidney fail to reabsorb the glucose, we pee a lot of it out, right? We pee the glucose out because we can't get it back into circulation, all right? And we call this glycosuria, right? And this just means we're peeing out a lot of glucose. So glycosuria, one clinical manifestation of diabetes, right, that we see. Now, to continue our story, right, if we're peeing out all this blood glucose, right, all this glucose, we should say, well, glucose is osmotically active, and that means that when we pee out glucose, we're going to pee out water along with it, okay? So now we're excreting a lot of water in the urine, and this is known as polyuria, all right? Excessive urination, all right? And so we got the glycosuria, we're peeing out the glucose, we got the polyuria as a result of the osmotic activity, right, of the glucose, right, and needing and accompanying water with it when we excrete it, all right? Hey, thank you for tuning in. We'll get to you in a second here. Thank you for hopping on. I hope you get something out of this. And so now we're peeing out all this glucose, right? Now, what also happens is we have high amounts of glucose in the blood, but we don't quite have that much water. We've been excreting a lot of water, right? And no, we can't reabsorb the blood glucose, but that's because we had so much of it in the blood in the first place, right? So this hyperosmolar blood, we could say, with all this blood glucose in it and not much water, right, reduces the overall blood volume, all right? And this triggers the osmoreceptors in the hypothalamus to become activated, right? And when this happens, when the osmoreceptors are activated in the hypothalamus, because we have a low blood volume, because we have so much blood glucose, and we don't have that much water in the blood, right? Well, the reason that it is triggered is because we're trying to balance this concentration, right, of glucose with some more water. So this causes us to get more thirsty, all right, because we want our body's saying, we need more water, right? This is known as polydipsia, all right? So we got glycosuria, polyuria, polydipsia so far, all right? And there's one more we're going to talk about here. So now we have this glucose in the blood, right? But with dysfunctional insulin, or say insulin resistance, or not producing enough insulin, or whether it's due to an autoimmune attack or eventual failing of the biological machine, that is the beta cells that produce insulin in type 2 diabetes, right? Well, we can't properly absorb the glucose in our cells, right? And get it out of that bloodstream, all right? So that means that, we're not absorbing the glucose, so we can't use it in the cells for energy, to break it down via glycolysis and anaerobic respiration to produce ATP. So our body still needs energy, right? And if it can't break it down, it's got to find it somewhere. So what does our body do? Our body's very intelligent, and it dives into our fat stores, and we get lipolysis, and it dives into our protein stores, right? And we get proteolysis, all right? So it breaks down amino acids and fats. But now as a byproduct, right? Well, again, the body's intelligent, and it knows that if it has to go do this and break down these stores, right? Well, it wants to replenish them, of course, for the future, right? And so we get hungrier. This triggers our body to become hungrier because it wants more fuel for the future, all right? And this is known as polyphagia, all right? So we had glycosuria, we had polyuria, we had polydipsia, and polyphagia, all right, as a result of diabetes, okay? Now, when we talk about the diagnosis of diabetes, well, there's a few ways you could do it, right? We all hear about HbA1c, and we'll talk about hemoglobin A1c in a second here, all right? But we can test fasting blood glucose levels, okay? And if we test fasting blood glucose levels, if they're greater than or equal to 126 milligrams per deciliter, this is a positive, granted that this measurement is accompanied by symptoms, directing us towards the potential diagnosis for diabetes in the first place, okay? So on top of that, you could test the blood glucose when we're in a fed state or a non-fasted state, and in this case, the levels could be, they have to be a little bit higher to diagnose diabetes, again, if accompanied by symptoms that would direct us there in the first place, once again, right? Like this polyphagia, polyuria, polydipsia, right? Yada, 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 right? Glycosuria. And if you test blood glucose levels in the non-fasted state or the fed state, a positive would be 200 milligrams per deciliter of glucose in the blood, greater than or equal to 200. All right? So if we're fasted, it's greater than or equal to 126 milligrams per deciliter of blood glucose, and if we're in the fed state, greater than or equal to 200 milligrams per deciliter of glucose in the blood. All right? So we can also do a 2-hour oral glucose tolerance test. All right? And with an oral glucose tolerance test, they're actually fed some glucose, the patient is, right? And then what we do is we test the glucose levels thereafter, because if you're intaking that glucose, right? Hence the name oral, right? Oral glucose tolerance, right? Well, normally insulin would take it to the tissues. It would reduce the blood glucose levels accordingly, right? But if we see that we have blood glucose levels that are 200 milligrams per deciliter or greater, well, this again is a positive, but it's got to be done twice to confirm that. All right, this test has to be done twice. The 2-hour oral glucose tolerance test. All right. Now another one is HbA1c. I know you've been waiting for it. You fine feathered people out there and doctors alike, whoever, and you're like, he's got to talk about HbA1c. It's diabetes, right? And a positive with HbA1c levels is greater than or equal to 6.5%. All right. So what is HbA1c? Hemoglobin A1c. Well, hemoglobin A1c, it measures the amount of glycated hemoglobin, or hemoglobin that is bound to glucose. All right. And hemoglobin, we know, is contained in red blood cells, right? And it's for this reason that we measure HbA1c every 3 months, because 3 months is the lifespan of red blood cells, the average lifespan of a red blood cell, right? So that's why we measure it every 3 months. Now, again, when we talk about these measurements and things, we started by, seeing some symptoms and kind of directing us towards this route, to do these tests, right? We don't just kind of do them on a whim, right out of nowhere, right? Because there's so many different diseases out there that have similar or different presentations and things like that, right? So, that's when we do the tests. Now, another way we can test it, and help to diagnose diabetes is by testing amounts of antibodies present. All right, and we talked about in type 1 diabetes in particular, as it is an autoimmune disease and attack on the beta cells in the islets of Langerhans of the pancreas that are responsible for producing insulin, right? When we talk about testing these for these antibodies, we're testing for anti-glutamic acid antibodies, right? Which are antibodies against the enzyme glutamic acid decarboxylase, which converts glutamic acid to GABA and promotes, therefore, insulin release. When we get the GABA inside of a beta cell, promotes the insulin release of insulin from the beta cell. So if we attacked, inappropriately, of course, there was an autoimmune attack by the body on glutamic acid decarboxylase, then we're not getting GABA and in the beta cells, and that means we're not going to be releasing insulin, at least in that way. All right. Another way we can test for antibodies is testing for anti-islet cell antibodies, and we said that and more specifically, the beta cells, right? Because they're responsible for the production of insulin, and it's called anti-islet cell antibodies because beta cells are in the islets of Langerhans of the pancreas once again. So we also have antibodies that will attack them in general. And last but not least, we could test for anti-insulin antibodies that will straight up just attack the insulin. So even if you were producing it, it's still getting attacked, and it's no bueno, right? So one way or another, that insulin isn't going to be able to get there and promote the uptake of glucose into tissues to get it out of the blood, and you're going to have high blood glucose. All right. Now, these are many ways we can diagnose diabetes. All right, and again, the antibody test is more right for type 1. As we said, it's an autoimmune attack, right? And you don't really hear about the antibodies as much with type 2. All right, so that's it for today. Tomorrow, we're going to talk about some complications that can be suffered as a result of diabetes. And, there's a lot. It's a long list, unfortunately. Diabetes is just such a wide range of terrible things that can happen to someone, and that's why it should be taken so seriously. Keep your sugar in moderation, right? And get natural carbs. All right, and we're going to devote a day 2 to talking about the difference between added sugars, natural sugars, all these artificial sweeteners, right? Sugar alcohols and things like that. But as for tomorrow, again, we'll get into the complications. And that's it for today, people. So let's see who we got on here. Say hi to the homies. Samo, what's up, baby? I love you too, man. I love you. Hey, good to see you on here, my brother. I hope you're killing it. I know you're killing it. You don't even got to tell me, because I know you. Danny Kip, what's up? Take it easy. It's enough. Dogs are protecting us. Stupid dogs. The Champ, how you doing? Thank you for hopping on and flip the switch. I hope you guys got something out of it. If you did, like it or share it or leave a comment below. I don't make anything on When Wellness, but I want to spread some good knowledge to the people that can help them improve their lives. Because again, as we say every day, just about that is what When Wellness is all about. You improving your own life for free, right? Because that's how it should be. That should be our slogan. Thank you very much. Have a great rest of your day and night. We'll see you tomorrow, you guys. Not sure where, not sure when, but we'll see you then. Have a good one. Thank you so much. Happy When Wellness.